Hello everyone, my name is Taylor Randall and today I'll be presenting on cystic fibrosis, a genetic disorder that affects thousands of people worldwide. In this presentation, I'll explain what cystic fibrosis is, how it is inherited, what causes it at the cellular level, how it is diagnosed and treated, and what researchers are doing to improve the future for people living with this disease. Cystic fibrosis is a hereditary genetic disease caused by mutations in the CFTR gene. It mainly affects the lungs and the digestive system, especially the pancreas. People with cystic fibrosis produce unusually thick, sticky mucus that blocks airways ducts throughout the body. This can lead to chronic lung infections, breathing difficulties, and digestive problems. Before scientists understood the disease, many children became very sick without doctors knowing why. Today we know cystic fibrosis is one of the most common life-threatening inherited disorders in the United States, affecting around 40,000 people. Cystic fibrosis was first recognized as its own disease in 1938 by Dr. Dorothy Anderson. She noticed that many children who had severe malnutrition and recurring lung infections actually had the same underlying disease. Before her discovery, these children were often misdiagnosed. A major breakthrough occurred in 1989 when researchers discovered the CFTR gene, which allowed scientists to understand the exact genetic cause of cystic fibrosis. This discovery led to genetic testing, earlier diagnosis, and the development of targeted treatments. Cystic fibrosis follows an autosomal recessive pattern of inheritance. This means a person must inherit two mutated copies of the CFTR gene, one from each parent, to develop the disease. The CFTR gene is located on chromosome 7, specifically at locus 7q31.2. Parents who carry only one mutation are called carriers. They usually don't show symptoms because one normal copy of the gene still works. If both parents are carriers, each pregnancy has a 25% chance the child will have cystic fibrosis, a 50% chance the child will be a carrier, and a 25% chance the child will inherit two normal copies. How CF works. Normally, the CFTR protein acts as a chloride channel in the cell membrane. Chloride ions move through the channel and water follows them by osmosis. This keeps mucus thin and able to protect the lungs and digestive system. When the CFTR protein is defective, chloride cannot move properly. Water does not follow, causing mucus to become thick and sticky. This mucus blocks the airways, traps bacteria, and leads to repeated infections and inflammation. Over time, these infections damage lung tissue and reduce lung function. There are several ways doctors diagnose cystic fibrosis. Most babies are identified through newborn screening, allowing treatment to begin early. The sweat chloride test is considered the gold standard because people with cystic fibrosis have abnormally high chloride levels in their sweat. Doctors also use PCR and DNA testing to identify mutations in the CFTR gene. Carrier screening can also be performed before pregnancy to determine whether parents carry the mutation. Symptoms vary depending on the individual, but some common symptoms include chronic coughing, wheezing, repeated lung infections, poor weight gain, digestive problems, and frequent sinus infections. Many patients have difficulty absorbing nutrients because digestive enzymes cannot reach the intestines normally. Without treatment, symptoms usually worsen over time. Cystic fibrosis affects several organ systems. In the lungs, mucus blocks the airways and causes infections. In the pancreas, digestive enzymes become trapped, making it difficult to digest food and absorb nutrients. The liver can also be affected if mucus blocks the bile ducts. The reproductive system is affected as well. Most men with cystic fibrosis are infertile because the vas deferens is often absent or blocked. Women may have reduced fertility, but can often still become pregnant. There is currently no cure for cystic fibrosis, but treatments have improved dramatically. Patients often take pancreatic enzyme supplements with meals to help digest food. Airway clearance therapy, including therapy vests, help loosen mucus so it can be cleared from the lungs. One of the biggest advances has been CFTR modulator medications such as Trifecta, which actually improve the function of the defective protein in many patients. Because of these treatments, many people with cystic fibrosis are now living into their 50s and even longer. In severe cases, lung transplantation may also be considered. There are also important bioethical issues surrounding cystic fibrosis. Many of the newest medications cost hundreds of thousands of dollars each year, making access difficult for some families. Not every patient qualifies for CFTR modulators because treatment depends on the person's specific genetic mutation. Researchers are currently studying gene therapy and CRISPR gene editing, which may someday repair or replace the faulty CFTR gene instead of simply treating symptoms. Although these technologies are promising, they also raise ethical questions about cost, access, and genetic modification. In conclusion, cystic fibrosis is a lifelong inherited disorder caused by mutations in the CFTR gene. It affects multiple organ systems, especially the lungs and pancreas, and follows an autosomal recessive inheritance pattern. Although there is no cure, early diagnosis, better treatments, and advances in biotechnology have dramatically improved both life expectancy and quality of life. As research continues into gene therapy and gene editing, scientists hope that future treatments may one day provide a permanent solution. Thank you for listening. I'm happy to answer any questions.